Hi, my name is Elizabeth Macnab, and I'm one of the trainers for the Step Up to Elder Abuse video series, Take Steps to Recognize and Prevent Elder Neglect. This video deals with elder neglect. What will you learn in this video? In this video, we focus exclusively on elder neglect. We hope you will know how to recognize the signs of elder neglect and prevent it in the future. If you believe that you are being abused and are in immediate danger or risk of harm, please call 911. At the end of the video, we have a case study to help you understand better what elder neglect is. The Ontario Society of Senior Citizens Organizations has been around for more than 30 years. We bring together individual seniors and organizations together to enhance the quality of life of aging Ontarians through knowledge. OSCO develops a variety of active learning programs which are available in select locations in the province. Elder neglect can be defined as follows. It happens when there's a failure to fulfill a caregiving obligation. Elder neglect may be intentional or unintentional, based on factors such as ignorance or denial that an elderly person needs as much care as they do. What could elder neglect look like? Here are some of the warning signs of what elder neglect looks like, even if it's similar to self-neglect. There's an unkept appearance, inappropriate or dirty clothing, signs, or infrequent bathing. Living conditions may be unhealthy, dangerous, or in disrepair. There's a lack of social contact. The individual may have bed sores, skin disorders, untreated injuries, or medical problems. There's no regular medical appointments to deal with these. The individual suffers from deprivation of nutrition or hydration, or may be abandoned in a public place. It's difficult to take care of a senior who has very many different needs. For the elderly, it's also difficult to deal with their own infirmities and dependence. Both the demands of the caregiver and the needs of the elder can create situations in which abuse is more likely to occur. Who's at risk at elder neglect? People who are 100% dependent on a caregiver for health care or financial management are at a greater risk of neglect, especially as their conditions change or deteriorate. The elderly person is at risk when the caregiver is unable to provide basic or personal care needs, or is unable to or unwilling to manage the elder's finances. They may be deprived of such things as food, water, required medications, shelter, hygiene, clothing, physical aids, exercise, and social interactions. The caregiver needs of the elder escalates. A caregiver may then begin to experience stress, resulting in burnout. They may become more prone to becoming impatient or lashing out at the elders in their care. Both non-professional and professional caregivers find the responsibilities and demands of care escalating as the elder's conditions deteriorate. Caregivers and institutions can also demonstrate symptoms of burnout. The elder may become victimized, over or under-medicated, or services withheld in their response. If you are a caregiver, you need to be aware of the following signs of burnout, as you may need additional resources in the care of the elderly person. Be aware that the senior may also have a tendency towards verbal and physical aggression, and seek out the help that you need in their care. Find a support group for caregivers of older people to share your concerns and experiences with. And don't forget to take care of yourself. Get enough sleep. Have proper nutrition, hydration, and seek out mental health support to deal with depression or perhaps feelings of being overwhelmed. As you prepare to age as a senior, have a plan in place to reduce the risk of neglect from happening to you. Ensure that your plan includes more than one person providing care or looking after your finances. Make sure people stop in and visit you to observe what's happening with you. Do not be afraid to speak to a trusted person, perhaps a medical professional, a social worker, friend, or neighbor, if you feel you are being neglected. And please call 911 if you feel you are in immediate danger. Neglect can happen to anyone and anywhere. If you observe that someone is being neglected, they're more likely to talk to you if they feel you're being supportive. Through gentle conversation, you might learn when things started to happen for them or the reasons the caregiver's coping skills no longer function well. For example, the elder may tell you about the frequent arguments they have between them and the caregiver. They may tell you that they're hungry, have not bathed in weeks, or are ill. Inquire if the senior has access to medical services or offer to visit them. But do not ever confront the abuser, as it may put the elderly person at risk. You can also contact 211 for information on reporting neglect. Again, if you believe the elder is in immediate danger or risk of harm, call 911 to report the neglect. And here is our case study. Let's review it together. Irene is an 80-year-old Russian-speaking woman. She had a heart attack 3 years ago and has dementia. She lives with her daughter, who's unemployed. Shirley, the daughter, cashes her mom's CPP checks and gambles because she thinks she can make a little bit of extra money. Some months, there's not enough money for Irene's medications. When Shirley goes out at night, Irene is left on her own for many hours. Irene forgets to eat her meals, if Shirley makes them for her. Irene goes to bed without showering at night because she's afraid she will fall. Shirley always has time to look good and enjoys being out for drinks with the girls. When Irene was admitted to hospital recently after a fall, she told the doctor everything was okay. She was ashamed to tell anyone how her daughter treated her and neglected her. So let's do a quick check now. Can we tell what are the signs of abuse? Who is the victim? Who is the abuser? And in this case, what type of example of elder abuse it can be? Well, if you thought these were the answers, you're probably right. What are some of the signs of abuse? We know Irene is not bathed or showered. She's dirty. Irene doesn't have her medications always because there's not enough money. Irene does not always provide food for Irene, who goes hungry. And Shirley may be showing signs of caregiver burnout because she's going out with her friends and neglecting her mother. Who is the victim? The victim here is Irene. Who is the abuser? The abuser is the caregiver, Shirley, the daughter. In this case, do we believe that the elder is abused? Yes, we believe it's elder neglect. Irene depends on her daughter for everything. And Shirley does not make sure that her mother is clean or fed or has what she needs to live. There's no medications for her mother sometimes. Shirley uses her money for her own interests and not the care of the elder. In this video, you learned about elder neglect. We learned what elder neglect is, what elder neglect could look like. We also discussed who's at risk of elder neglect and how we can prevent elder neglect from happening to the caregiver and to the senior. We also talked about a senior who is being neglected in our case study. We encourage you to visit OSCO's website at www.ossco.org under the Step Up to Elder Abuse Resources and Information section for a complete list of agencies who can give you information, who can provide referral for you and support on the topic of elder abuse. If you do not have access to a computer, you can also contact OSCO by phone. Just dial 416-785-8570 to ask for the list of agencies to be mailed to you. And thank you. Thank you to New Horizons for Seniors for funding these elder abuse awareness videos, and we hope this video has been helpful to you. Please visit OSCO's YouTube channel to learn more about the other types of elder abuse and our 7-part video series. You can also visit our website at www.ossco.org for more information on elder abuse awareness and prevention, including under our Ask an Expert section. You can also dial us by phone for more information on the elder abuse awareness and learning programs. Thank you.